there. It's vicious, the sun and so forth. But I'll share with you a little bit of what I went through and what I'm sure a lot of you are familiar with and are going through right now with as caregivers or as cancer survivors. When I say it's good to be here, man, I mean it's good to be here, okay? And at one time I used to say that in a passing phrase as a greeting and that and so forth, but when you have 4 or 5, I forget how many doctors, specialists, oncologists, tell you that you have adenocarcinoma, non-small cell, lung cancer, stage 4, and you had no idea this was happening to you, it's a shot in the gut. And I'm sure everyone out here has known someone or has dealt with someone in their families that have gone through that. And I'll tell you what, with the obvious question that you always ask, or at least I ask, when I found out about my cancer, I didn't know the severity, and ended up going to Cleveland Clinic and had my family there, and 3 kids flew in from California, from New York, and from Virginia Beach, and we were all sitting there listening to the diagnosis and so forth. Obviously, my first question was, after he told me about what I had, well, what can we do? You know, what do we do about this? Do we cut it out? Do we burn it with radiation? What can we do? And man, the doctor looked at me, so I'm going to give it to you straight. He says, we don't have anything. Lung cancer, it's like I said, you have stage 4, and we really don't have any answers. And again, another kick in the gut and so forth. And that was 3.5 years ago. And my question to him, as I got ready to walk out the door, was, what are we talking about? And that's hard to say. I'm sure you know what I'm talking about. It's hard to say. How long do I have to live? Basically is what I was saying. And he said, well, 6 months, 2.5 years. And I look kind of like I do right now. I was feeling pretty good. I had, previous to that, as Joni alluded to, I had done a lot of activities, hiked the trail, and was doing triathlons and everything, and I had no clue. And I'll be honest with you, I thought lung cancer was for smokers. Okay, and I found out real quick that 20% of the people in the United States that has lung cancer are non-smokers, and it totally shocked me. But anyway, that was 3.5 years ago, and for 2 years, I'll be honest with you, I didn't have much hope. They basically, I did radiation. I think we counted up, and I had seven different. Excuse me, I didn't have radiation. I had chemotherapy, and I had basically 7 different chemotherapies through the 2 years, and I can tell you, and everyone knows standing here, it literally kicked my butt. I mean, it had me whipped. I remember talking to a doctor one time, and I said, you know, this chemo, what's the side effects of this chemo? And basically he said, well, it's not too bad. Everybody's affected differently. I have guys going to work and so forth. Well, I'm telling you right now, going to work, I couldn't even get off the couch. I mean, it was terrible. Words can't express what it was like. And again, caregivers, cancer survivors, you know what I'm talking about. That's the negative part. The positive part came right about 1 year ago. And it was, and I'll make this fairly quick because, again, I know it's hot out there and everything. And a lot of you know this, but basically I was watching TV approximately, like I said, a year ago, and channel ABC News. I hardly ever watch that, but I happened to be watching it. Wasn't paying a whole lot of attention. I was listening, but I wasn't listening, if you know what I'm talking about. We used to have students in class that did that. Matter of fact, I was one of those students. I listened, but I didn't listen, if you know what I'm talking about. But anyhow, so I wasn't paying a whole lot of attention. All of a sudden I heard, well, we have a segment on lung cancer survivor. And I'm thinking, well, no one survives lung cancer. They told me there's no cure. But I still kind of listened. And making a long story short, the lady came on, and it was a new treatment, a clinical trial that they were trying. And she had adenocarcinoma, a non-smoker just like myself, had tried all different kind of chemos, was down to her knees. And believe me, it brings you to your knees. And she basically said that on this clinical trial, that her cancer was, how did she put it, melting away. I don't think I'll ever forget that. She said, my cancer is melting away. And I'll tell you what, I was off that couch and my feet didn't hit the ground until I was in the computer room trying to get on ABC News and find out the name of the hospital and so forth. I did all that, got a hold of the doctor, Dr. Shaw, an unbelievable lady, young lady who is just so sharp. She saved my life, basically, is the way I look at it. But she explained to me that they have a specific treatment for a certain type of lung cancer, but you have to have a certain DNA in order for this to be effective. And it's a long shot, but if I was willing to try, it sounded like I might be a candidate. Went through a lot of different processes. I had to send to get my my cancer cells sent off, and I called one place, and they lost my cells. And you can go through all that stuff with the hospitals. But basically, I found out that I was tested positive. Only about 20% of the people who have lung cancer have my type of lung cancer. 10% of my type test the DNA that I tested. So it was still a long shot once I got it. But I'll never forget, I went to Boston, and I was sitting on this hospital bed, and they brought the medicine to me, and of course it's a clinical trial. And I'll keep saying that. It's not on the market yet. It's a clinical trial drug. There's no guarantees whatsoever. But I'll never forget, I sat on the table, or I sat on the bed, and they basically gave me the medicine. And this is where it's probably going to be hard for you to believe. If I hadn't gone through it, I don't know if I'd believe it. But and I have been in a lot of pain. Everybody's dealing with pain with cancer, but my lung cancer, for some reason, I had it in both lungs. It was on the outer, and they said it was not supposed to have pain. They said, your lungs don't have nerve endings, so you shouldn't have pain. Well, believe me, when I coughed, it took me to my knees.